Hi there, my name is Janie Umstadt. I'm going to be your student family nurse practitioner. How are you doing today?
Fine. I got an earache.
Earache in your left ear?
Yes.
Any other symptoms?
No.
No? Alrighty, well we will take a look at that. We have a 63-year-old white male, appears in no apparent distress. Chief complaint is left-sided ear pain. So his neck is symmetrical to the rest of his body, and it is midline. Skin is clean, dry, and intact, and warm. Any pain or tenderness?
No.
No. And can you do head up? Good. Head down. Left, right, and then press against resistance. My hand. Good. Full strength, full range of motion, and then shrug shoulders up. Good. Cranial nerve 11 is intact. I'm going to palpate the thyroid. Any pain or tenderness? And can you swallow? Good. Thyroid is midline. I'm going to have you take a sip of water. Wonderful. Patient is able to drink without aspirating. I'm going to palpate your sinuses. Tell me if you're having any pain or tenderness, okay?
Okay.
Any pain or tenderness?
No.
Pain or tenderness?
No.
No pain or tenderness in the frontal or maxillary sinuses. Now we're going to do lymph nodes. So occipital. Any pain or tenderness?
No.
Postauricular, preauricular, tonsillar, submandibular, submental, and mandible. Pain or tenderness?
No.
Cervical, deep cervical, posterior cervical, superficial cervical. I'm sorry, these were the clavicular. Any pain or tenderness?
No.
No? Alrighty. Now we are going to assess the eyes. There is no swelling present. Any pain or tenderness?
No.
No open angle glaucoma. And can you follow my finger? Good. Good. And watch my finger. Good. Pupils accommodate appropriately to convergence. Good. Good. Pupils equal, round, and reactive to light accommodation and convergence. Now we're going to perform the eye exam. I'm going to turn off the lights for this. The sclera is white, red reflex present, iris is intact, conjunctiva is as expected bilaterally. Blood vessels are visible as expected. Good, and now I'm going to turn back on the lights. And I'm going to start with your right ear. So, any pain or tenderness?
No.
Okay. No lumps, masses, or nodules, no drainage, fluid, or blood coming from the right ear canal. We're going to perform the whisper test now. I'm just going to have you cover your right ear. I'm going to whisper 3 numbers, and you just repeat them after me. 5, 8, 4.
5, 8, 4.
Perfect. And then your left ear. 7, 2, 9.
7, 2, 9.
Good. And if there were any abnormalities or any hearing loss noted, we would perform the Weber or Ren test. Now, I'm going to inspect your right inner ear canal. The malleus is visible, tympanic membrane is visible and pearly gray, no disturbances in the point of light reflex, a little bit of wax and cerumen in there, but nothing abnormal. The left ear, any pain or tenderness?
It's a little bit sore.
A little sore. No lumps, nodules, or masses present. Skin is clean, dry, and intact. There's no blood or fluid or drainage coming out of the ear canal. There is a little bit of cerumen present. The tympanic membrane is visible and it appears to be slightly bulging. It appears that there's a little bit of fluid behind that ear and that membrane, but it is pearly gray, no disturbance, and the point of light reflex. Now we are going to do the nose. Any difficulty breathing that you felt recently?
No.
No. Any pain or tenderness?
No.
And can you close this snare? Good. This one? Good. Nares are both patent. Okay, and just look up for me. Good. Nasal mucosa is pink and moist as expected. And now I'm going to inspect the lips and the mucous membrane, and your inner mucous membranes. Lips are intact, appear slightly dry, but they are pink. And then, can you open up and say ah?
Ah.
Say ah again.
Ah.
Good. The uvula rises as expected. Tonsils, does not have tonsils anymore. History of tonsillectomy. The tongue is midline and is attached to the teeth are intact. No loose teeth present. And the soft and hard palate are both intact. There is no bleeding or gum recession noted. Great, here's healthy. Alrighty, now I'm going to listen to your lungs. We're going to start with your backside, okay? I am inspecting and palpating the posterior chest. Any pain or tenderness?
No.
No lumps or nodules present. No heaves noted. The the transverse AP diameter appears proportional. Can you inhale for me? And exhale. Good. Symmetrical on inhalation and exertion. Now you're going to feel my hands, and when you feel my hands, just say 99.
99. 99. 99. 99. 99.
Good. Tactile fremitus is present, but as expected. Now I'm going to percuss. Good. Lungs are resonant. Now I'm going to auscultate your lungs. Inhale and exhale. Good. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Great. And then laterally inhale. Great. Your lungs sound perfect. Clear and equal bilaterally. No rales, wheezes, bronchi or crackles present. Now we're going to do the anterior side. The lung inhalation and exhalation appears symmetrical. Any pain or tenderness? No.
No.
Pain or tenderness? Any pain when you inhale or exhale?
No.
Good. No lumps, nodules, or masses. I'm now going to percuss. Good. Lungs are resonant as well. Now I'm going to auscultate. Deep breath, inhale and exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. 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 Good. No crackles, wheezes, rales, or bronchi present. Lungs sound clear and equal bilaterally. There are no diminished breath sounds. Now we're going to listen to your heart. Any history of cardiac problems? No? Okay. Wonderful. So I'm going to find my sternal notch. Second intercostal space, right sternal border, also known as the aortic area. Second intercostal space, left sternal border, pulmonic. Third intercostal space, left sternal border, Erb's point. Fourth intercostal space, left sternal border, tricuspid. Then mitral, also known as the point of maximum impulse. I'm going to listen again with the other side, the bell of my stethoscope. Aortic, pulmonic, Erb's point, tricuspid, mitral. Good. I heard S1 best over the mitral area and S2 best over the pulmonic. There were no clicks or bruise present. Let's see. And can I see your fingernails? Good. Cap refill is less than 2 seconds. Alrighty. And that includes our focused physical examination today. I appreciate you for your time.
Okay.
Thank you very much. We'll get going on some antibiotic prescriptions, okay?
Excellent. Thank you.
You are welcome.